Metabolic acidosis workup. Metabolic acidosis workup starts by categorizing the metabolic acidosis. When a patient blood gases show a pH below 7.35 in setting of PaCO2 less than 40, the picture is more likely a metabolic acidosis. Metabolic acidosis can be categorized either as anion gap metabolic acidosis or as non-gap metabolic acidosis. If it's a metabolic acidosis picture, it's important to calculate anion gap in order to categorize metabolic acidosis. When anion gap is more than 12, then that is anion gap metabolic acidosis. We calculate anion gap by adding the values of chloride ions and bicarb, then subtracting from sodium. If the value is more than 12, then we have anion gap metabolic acidosis. Causes of anion gap metabolic acidosis include ketones in patients who have diabetic ketoacidosis. Lactic acidosis is another cause of anion gap metabolic acidosis. Other causes include methanol, propylene, ethylene glycol, iron overdose, salicylate overdose, and uremia. Non-gap metabolic acidosis, on the other hand, can be seen in patients who have diarrhea, also seen in patients receiving normal saline infusion, in those with pancreatic fistula, renal tubular acidosis, and those with acetazolamide. Of note, acetazolamide is a carbonic anhydrase inhibitor which alkalines urine. Always talk to your doctor about your health.